In both quantum physics and psychotherapy, measuring something can help change it. Today, I'm going to give you a flexible worksheet that can be used to measure almost any therapy goal. Most CBT therapists are used to using depression and anxiety measures throughout therapy. But what do you do if the client's goals are something different, a different mood, behavior change, or even something physical like chronic pain or relaxation? You could just use a simple measure of 0 to 10 and rate something, but that leaves out some important information. For example, if I'm trying to measure positive interaction with my family members, and I rate 2 days a 5 out of 10, one day that might mean that positive interactions were kind of middle of the road throughout the day. And another day it might mean that I had really good positive interactions part of the day and a big fight at some point that kind of spoiled the day for me. When Dennis Greenberger and I wrote Mind Over Mood, we puzzled about how to handle this sort of situation, and we ended up creating a new worksheet called Measuring and Tracking My Mood that asks clients to rate their experiences on 3 dimensions: frequency, strength, and duration. By using these 3 dimensions, this solves a lot of problems. So those 2 days when I'm increasing the positive interactions with my family, one day I might have a higher frequency of positive interactions, and another day I might have higher strength of positive interactions. And we can then discuss in the session what this is about and how to make changes in the ways that are most meaningful to me. We encourage you to use this multidimensional worksheet and collaborate with your clients to individualize it to capture the dimensions that are most important to them. For example, with some goals, clients might want to increase or decrease the frequency of something. With other goals, it may be much more important to them to increase the strength of the experience or the duration of it. You can even modify the scales in each dimension. So for example, if your client is trying to increase happiness in their life, we rarely experience happiness consistently over several days. So you might want to change the duration markers to be less than a minute, a few minutes, and some dimensions that are more meaningful to them. In this way, when you track all 3 dimensions of a client's experience toward progress, the client will be able to notice changes more quickly. There are 3 benefits to using this multidimensional worksheet. The first is it increases client awareness of the things that they're trying to change. The second is it helps them notice small changes on 3 different dimensions. And finally, if you and your client fill this out week by week, you're going to get regular feedback about whether therapy is helping or not. To download the worksheet, follow the links below. And if you like this video, consider giving us a thumbs up. And to be notified of future videos in our series, please subscribe.